Hey guys, my name is Maura. I am a nurse practitioner with 5410 and Club Compound. I've been a provider with them for about a year and a half and a patient for about a year. Our bodies have a hormone that helps us feel full when we eat. This medication mimics that hormone to help us feel full quicker. I started out on Semaglutide, ended up switching over to Tirzepatide. Both of them have worked great for me. I lost my first 20 pounds about on Semaglutide, and then I ended up switching at the 1 milligram. So I went from Semaglutide 1 milligram to Tirzepatide 7.5 and switched over that way and then increased from there. And I love it. I am one of those people who tolerates it great and doesn't really have any side effects. I just ended up switching just from a little stall on Semaglutide. My kind of weight loss was slowing down. My appetite suppression wasn't as good. I was out of my Semaglutide meds. I could either get more Semaglutide or switch to an equivalent dose of Tirzepatide. I just chose to make that switch. I liked the way I felt on Semaglutide, and I really like the way I feel on Tirzepatide. So it wasn't much of a difference, like side effects for me wise. I tolerate them both pretty well. I did notice the weight loss was a little bit quicker with the Tirzepatide. I lost about 60 pounds in the last year on combo of Semaglutide and Tirzepatide. Semaglutide first, Tirzepatide second, not together. My biggest wins, I would say confidence. I'm a mom of two, being able to run around with my kids and not feel like I'm in the wrong clothes, self-conscious around my kid. It's kind of a wild concept, but the confidence I have in myself, truly, that helps me be a better mom, a better wife, a better friend. They are in the same drug class, so they're both GLP-1 drugs, glucagon-like peptide receptor agonists. So they work in the same ways as far as making you feel full quicker, helping with that food noise and satiety. Tirzepatide has an extra enzyme in it that helps with fat metabolism. So it's also, while it's a GLP-1, it's also a GIP. So it's two drug classes in one. So it gives you that extra enzyme that helps with fat metabolism. So that's why we generally see quicker weight loss with Tirzepatide and a little bit faster results. So a lot of people are like, well, I want to do Tirzepatide because I don't want any side effects. Well, if you've never been on either, I can't predict how everyone's going to react. Generally, patients say that Tirzepatide has less side effects, though the research actually tells us their side effects should be the same. But everyone's different. Side effects, maintenance, weight loss expectation, everything. The first thing I'm going to say is that everyone is different in how they respond. My favorite thing about being a GLP-1 provider is when I help patients who are stalled or in a plateau. I love troubleshooting that with patients. Somebody's on 15, they've been on 15, they're stalled. Let's talk about it. I love when I'm just going through people's charts and I see they've lost a significant amount of weight in a healthy way and they comment on their form. I feel amazing. Please give me a refill. I resonate so much with a lot of these patients because I've been overweight the majority of my life. I remember going on my first diet at 15. A lot of our communication is through the portal, but I do occasionally have phone calls with patients who want to have a phone call or they're having issues or whatever. And when I'm talking to somebody and they're like, you don't understand, I've been, this, and this my whole life. I'm like, I truly do understand. I truly want to help you. When I was going through nurse practitioner school, I was not sure what I wanted to do. I knew I wanted to specialize. I actually thought I was going to go into ENT, ear, nose, and throat specialty. This position fell in my lap like a gift from God. And it's like, I didn't know that I could do that. I didn't know that I could just, I could just help people lose weight. But it's something that I've thought about my whole life because I've been there. So it is my dream job for sure. Being a provider and a patient does give me a unique perspective. Everyone has their unique niche, right? We have certain providers who are so good with hormones. And the best thing about being able to talk with the other providers is we can bounce ideas off. So if I'm like unsure on something, I know I'm going to reach out to Doug about hormones or lab interpretation, right? We are telehealth, but like we still work together, like learn from each other. You know, whenever there's new research out, our lead nurse practitioner, Allie, makes sure we all kind of know about that. I think it does help me relate for sure. One of like the myths I feel like we need to debunk is that you should feel terrible on these medications. Like that is so not true. You should feel good. And if you're feeling bad, you're on the wrong dose. Nurses that I was working with who were on the medication, like the branded medication, they were like, I'm just in the toilet all day. I feel like crap. And as I was starting to learn about these meds, I'm like, oh, that's right, you know? And like now I'm like, no, like your dose is wrong. Whoever's taking care of you is not paying attention to your side effects, or you're not being realistic with them about your side effects. One of the things that I want people to know is that you should feel good on this medication, not bad. Some nausea or something in the beginning as you're getting used to a dose. And as long as it's manageable and mild, that's okay. But you should feel good. Some patients hear that you can lose the most weight on the highest dose, so they race to get to the highest dose. I was like, okay, well, let's slow down. Let's stay on the lowest working dose. You don't want to get the highest dose. Once you get to the highest dose, we have nowhere to go. We always say you should stay on the lowest working dose for you for as long as you can. Some patients hear that there's bad side effects on the highest dose, so they are terrified to get to the highest dose. We generally do see a rare side effect like pancreatitis or something like that that have been associated with GLP-1s. Generally, they're with the highest 2 doses. That does not mean if you do the highest dose that you're going to get that. It means it's a risk. And there's a risk with every medication. With our telehealth platform, we're able to really personalize it. We don't necessarily want to get to a high dose if we don't have to. But if you need that high dose, then that's okay. As a patient, you can literally message us with anything. Any side effects that are not manageable at home and you feel like are affecting your daily life, just reach out on our portal so we can talk about it. If you're having constipation, nausea that is lasting more than a few days, if you ever vomit one time, you should message us. Vomiting is not normal. If you've vomited once on this medication in the past 6 months, okay. But like if you're having weekly vomiting, not normal. We need to talk about it. We need to see what that's happening and try to prevent it. Our nurses are amazing. They will troubleshoot everything. And then when they need to reach out to the nurse practitioner, then they will. I have a patient that's like, well, I didn't know what to do, so I just did this. I'm like, just please ask. If you're ever questioning a dose, should I go up or should I not? Confused about the concentration. If you just got a new order and you are taking 100 units and now it says to take 50, please reach out. Do not take your old amount. We do have to work with different pharmacies. Different pharmacies use what's available. Sometimes we have to do different concentrations. Please read your instructions with each new order. Every compounded medication has a concentration. That is the amount of medication that is in an ml. Your dose is the amount of milligrams that your provider puts you on. The amount that you need to take to reach that dose is your units prescribed, and that will be on your prescription. We send you syringes with your medication. Generally, they are 100 unit syringes. It is really important to use the syringes that come with your package. I have seen some things online about people not wanting to take 2 shots when they get to the higher dose of Tirzepatide. So they're ordering like 3 ml syringes on Amazon. That is a no-no. Do not do that. You're going to accidentally overdose or underdose yourself, and you don't want to do that. 1 ml is 100 units. You need to be using the syringes that we send you, or if you get them online, they need to say 100 units. And if you have any questions, you take a picture, you send it in the portal, and we will verify everything for you. I'm thankful that these drugs are around during my lifetime, to be honest, and I love helping other people with their journey on them.